Assalamu alaikum and good morning, and welcome you all guys in the lecture of the series of the public health. In the today lecture of the public health, we will learn about the 3 P's. What is these 3 P's and what is these 3 P's is stand for? These 3 P's are the core principles of the public health. It is vastly used in the field of the public health in order to control the burden of the diseases. Let's to go through from the abbreviation of the 3 P's. What is these 3 P's is stand for? The first P is for the prevention. Okay, it means to prevent the people, to prevent the population, okay, or the community from the diseases. When you prevent the population, the particular population or the particular community, when they prevent from the disease, definitely it is decrease the incidence of the diseases, incidence number of the diseases in a particular population and a particular geographical area. Now, what are the best example of the prevention? The best example of the prevention, you can eliminate or you can control or you can control or you can control on the creation of any risk factor in a particular group of the people or in the particular community. When the first is the primordial prevention. Now, what is the means of the primordial prevention in the prevention? The primordial prevention means to eliminate the risk factor, to eliminate or to prevent from the creation of risk factor. When you eliminate or the control or decrease or prevent from the creation of any particular risk factor in a particular geographical area, in a group of the people or in a population, then definitely you will decrease the number of the diseases. You will create a barriers or you create a barriers or obstacles against the creation or occurrence of any diseases. The best example is the vaccination. With vaccination program, or you can say the EPI, how much you will immunize any community against the particular infectious diseases, it will increase the herd immunity of that particular community or the population, and then definitely it will decrease the incidence of the disease, or it will create the hindrance or the barriers against the occurrence of the particular diseases. Okay, and then the second word, lifestyle modification. Lifestyle modification, as you know, the non-communicable diseases is also is a high burden in our country, in the Pakistan. Let's to take the example of the diabetic mellitus type 2. Diabetic mellitus type 2 is around 31% in Pakistani population, according to the latest data. It is around 31% of the Pakistani populations account for the diabetic mellitus type 2. Now you can minimize this prevalence or the burden of the disease, or you can say in the next pupil, the next percentage will be added in the future in this burden of this prevalence of this diabetic mellitus. You can also prevent those people just only from the one strategy. This is called the lifestyle modification. You educate the pupil or communicate the pupil for the sedentary lifestyle, modify their sedentary lifestyle towards the active lifestyle. You can promote, you can educate the pupil for the exercise, for the daily walks, and controlling of the dietary pattern. So by the one this lifestyle modification, you can create a barriers against this increasing bar of the prevalence of the diabetic mellitus in the Pakistan. Let's to go on the second P. The second P is for the protection. You can, as a public health specialist, you can you it is the core responsibility of the public health specialist to protect the pupil from the injuries and from the any natural disaster or from any man-made disaster as well. So you know very well we have the three burdens of the diseases. Okay, three burden of the diseases, three BODs. The one is non-communicable diseases, and then the communicable disease, and the this is the single burden, and the combination of these both non-communicable and communicable, it is called the double burden. Now the another burden is called the triple burden, and this is the RTA or the injuries. Okay, now the combination of the non-communicable diseases, communicable disease, and the third one is the RTA or the injuries. This is called the triple burden. So the protection, you can protect the pupils from the injuries, you can protect the pupil from the natural disaster, you can protect from the pupil the more incidence cases or the more mortality or the morbidity from the situational crisis. Like the you can promote the pupil through the health education or the health promotion by using of the helmet while the bike riding. Okay, and use the seat belt among the drivers. By promoting the rules and implementations laws implementations of traffic. You can implement the use of the helmet while, especially in the youngster. You know very well the bike riding are the mostly 75% are the riding are the youngster from the age of the 10 to 30 years, and these youth populations are very productive population segment in any country. So when you protect the young populations, then definitely you can protect the productive performance of any country. So by using of the helmet, you can decrease the TIA, traumatic brain injuries, TBIs, traumatic brain injuries in the among the young populations. Yeah, you can protect the young population from the road traffic accidents. from their fracture, from their fractures and from their injuries, mostly from the TBIs, which is a very healthcare cost burden on the healthcare system, which is put the healthcare cost on the healthcare systems. And the second one, you can also implement the use of the seat belt among the drivers through the traffic rules, regulation, and the laws. So you know very well, as the public health specialist, by this one strategy, by the one intervention, you can decrease a lot of the burden, a lot of the number of the new incidence cases or the burden of the diseases among the population in any country. And you also can decrease the healthcare cost as well. And you can also prepare from the natural disaster. In the natural disaster, you can protect the people from the further injuries and the incidence cases. In the natural disaster, just like the earthquakes and then the floods, in the floods, you can also do the any more in healthcare interventions by which you can protect those people, the affected people or the affected population from the another healthcare problems. Now, the third P. The third P is for the promotion. For the promotion, health promotion. So, health promotion. What it means from the health promotion? By the health promotion, you will do? You will do empower the pupil and engage the pupil in the decreasing their health problem and controlling the diseases BODs in their community or in their populations. So by the health promotion, definitely you will educate the pupil. You will educate the pupil about their health problems. By educating and by giving the awareness to the particular population or the particular community, definitely they will become empowered by through the knowledge and by through the awareness and by the information, and they will be engaged himself and they engage themselves in the controlling of their health problems and also in the decreasing of the burden of the disease. The best example of the health promotion is to educate the people about to change their behaviors, like a BCC, behavioral change communication. By the behavioral change communication, you can change the behavior of the pupil about they avoid from those activities or from those lifestyle which is maybe harmful or maybe hazardous or risky for their pupil and risky for their community. Like the example, the sedentary lifestyle. Okay, sedentary lifestyle. By the sedentary lifestyle modification, you can educate the pupil. So, for the activity, for the exercise, to engage themselves in the daily walk or in the exercise by engaging to the pupil in the exercise or in the activity, definitely they can prevent themselves from the non-communicable diseases. Okay. As you know very well, the non-communicable diseases cost is more higher as compared of the communicable disease. So by this sedentary life modification, you can also prevent the three main diseases. Like one is the hypertension, ischemic heart disease, and diabetic mellitus, and then the strokes, or you can say dyslipidemia. So just by the one strategy, by the one modification, you can prevent a lot of the burden of the disease and that particular community. And you can also educate the people from the personal habits. Okay, change their personal habits. So what are the personal habits? The definitely cessation of smoking, cessation of the smoking, drug use. By the cessation of the smoking, you have to promote the campaign, you have promote the awareness and the um, informations among the particular community by their campaign, by promoting by their health education, to launch a campaign at the large scale level at the any particular community where the prevalence of the smoking is quite much is higher. Then you can launch a smoking cessation program or the education program for that particular community in order to decrease the different type of the diseases which is are associated with the smoking, just like the lung cancer, COPD, emphysema, and the tuberculosis, because the smoking is a comorbidity for the tuberculosis or the co-risk factor for the tuberculosis as well. So then you can also educate the women about their dietary or well balanced diet awareness during in the pregnant women. Okay, in the pregnant woman, as you know very well, which is I told you earlier, that the 44% of the Pakistani pregnant women are the iron deficiency anemia. Iron deficiency anemia. So just with the an educational program, health promotion program, or awareness program, if you will apply at the in the community levels, especially for the designed for the pregnant woman, and you will educate, if you will educate the pregnant women, so what are the dietary pattern they will use during their pregnancy, it will decrease the iron deficiency anemia among the pregnant women. Due to the nutrient risk factor, it may cause different type of their health problems in their reproductive maternal child healthcare lifespan, and it will be effects on the growth and the development of the fetus inside their womb. So I hope in the today lectures it is clear your concept about the three P's. And what are these three P's? These three P's is the core principle of the public health, which is vastly used in the field of the public health in order to reduce or the control or the decrease the burden of the diseases in the particular community. These three P's are the prevention, protection, and the promotion. Now, in the next lecture, we will see these three P's as been extended to reach the 6 P's. 6 P's. We will learn in the next lecture 6 P's. What are the three more P's has been added in beside of these three P's? Okay. And the last, I request you watch my video lecture properly. It will enhance your knowledge about the public health. And the last, I request you subscribe my YouTube channel and hit the bell icon. By hitting the bell icon, you will get my new lecture as soon as I upload on my YouTube channel. Thank you so much. Take care of yourself.